Hi, this is Stephanie Bean. I'm a physical therapist at Hayes Physical Therapy. I'm going to show you some stretches today you can do from a chair. I'm making these with my friends at Surrey in mind, and maybe for a population of people that have some trouble balancing and can use some stretches sitting down. I'll do some standing one next. So when we do these, you might want to have a few things around next time. One is a belt or a towel, and another is a Swiffer or a broom. So gather them and put me on pause and come back and follow along. But I'm heading back to my chair right now. In sitting, I'm going to do a hamstring stretch with one foot out in front of me, the knee nice and straight. I'm going to hinge from the hips and tip forward until I feel a stretch in the back of my thigh. That's your hamstring muscle. I like to hold stretches at least 10 seconds. You can hold them longer. You never want to push through pain when you do these. And you can alternate feet. I might do 10 seconds on one time. Switch sides. Lean forward, keeping your back nice and straight. You don't want to do these slouching. Head towards your knee. It's bad for your spine. So bending from the hips, nice straight back. Feel the stretch along the back of your thigh. Let's switch back. Again, hinging from the hips, bend with a nice straight back, feeling the stretch behind your thigh. If you feel like you're getting better, lunge a little farther, hinge a little more. You can feel a stronger stretch, but again, don't push through pain. Let's do one on the other side. My nice hinge. I feel the stretch along here. Nice, good stretch. Next, I'm going to do a calf stretch. Again, with the foot out in front of you, you can use a belt. Your foot out straight. Wrap a belt around the end of your foot, right around the ball of your foot, and pull back on the belt so that your foot comes closer to your knee. When you do that, you should feel a stretch in the back of your calf. Again, I'm going to hold this for about 10 seconds. And I'm just going to do 2 on each for demonstration. You can certainly do more at home. These are things you can spread out throughout the day. Or you can do a set of them all at one time. Even if you have trouble getting up and getting around, there are a lot of things you can do to move. Keep your joints healthy. Keep yourself moving a little bit. It's good for the blood flow, good for your heart, good for your functional mobility. So I'm going to switch again and do the same stretch, just showing you a towel. I pulled out a fairly big beach towel, and I'm just going to wrap it a little bit so that I can, again, loop it around my foot. And pull back my toes toward my knee. I feel a nice little calf stretch. Good stretches. It's nice to take a couple deep breaths when you stretch. You can maybe pull a little farther. The deep breaths might help relax the muscles. I see my co-stars are starting to arrive. There's a few cats coming around. Marley's the gray one. I've heard people wanted to know their names. He's walking around, checking me out. All right, towel is done for now. How about grabbing your broomstick or Swiffer? Swiffers are pretty light. You can use it in both hands and raise up to the ceiling to stretch your shoulders. And you hold it up till you feel a good stretch. Some people may not be able to go far, and I don't want you to push it through shoulder pain, but feel a pretty good stretch if you can. Couple seconds up there. Let's try it again. Come up, reach overhead. Be sure when you do this to bring your shoulder blades down. I don't want you to shrug, but keeping the blades down, stretch the shoulders up to the ceiling. You You can also do a sideways stretch in sitting if you have space. Use one hand to push the other one out sideways. You can go as far as you can, but stop when you feel a stretch. Normally, people should be able to get their arm up to the ear. If it hurts, you back it off. I feel a good stretch right there. And use the opposite hand to come back down. I'm going to try the other side. I have just enough room behind my table here to come out. Feel this stretch. You might have to readjust your hand position a little bit. Give yourself a good shoulder stretch. One more thing you could do from your chair are some neck stretches. Very easy to do. Again, don't push anything through pain. If you have any pain or discomfort, you should stop and maybe give our office a call. But you can do a little side bend, ear to one shoulder. If these are pretty tight, you might feel a stretch across from your neck towards your shoulder. Maybe you don't hold it as long if it's really tight. And try taking a deep breath or two throughout your 10 seconds. And then go to the other side. Same thing, big old stretch right through here. A lot of people are tight in that area. Stress makes those muscles tight. We tend to shrug our shoulders when we're stressed. My next co-star is Nomad under my chair. Let's go ear to opposite shoulder. Nomad's a little stray kitty who's tabby on top and white on the bottom. Let's go ear to other shoulder. You could also do a little neck rotation, turning to one side as far as comfortable, not pushing through pain. Then rotate the other way. Let's do one more to each side. One more to the right. One more to the left. You can try a little up and down stretching. Again, there are some reasons why people should not do these stretches with very specific problems if you've had certain surgeries or certain diagnoses. But let pain be your guide right now. If you have any doubts, just take a break. Don't do them. You could look up. You can look down. Stretches looking up are often good for people with disc problems. Stretches looking down are often good for people with spinal stenosis. This is different for everyone though. So again, just use your judgment. If you want to stretch the shoulder muscles, muscles between your shoulder blades, you can pull one arm across your body. I feel this stretch in the back of the left shoulder that I'm stretching, back in here, and the muscles from my shoulder blade to my spine. Nice upper back muscles called the rhomboids. I'm going to switch to the other side. Let's switch again. One more. I hope these have been helpful. I think that if you have any kind of discomfort or problems doing these, that you should give our office a call. We have physical therapists that can do screenings online. We have a lot of telehealth options, and our office is open if you need to come in and see us. We're taking all the precautions we can take and need to take. to keep everybody safe, both staff and patients. So we will have some information at the end of the video. But if you need me and have questions, give our office a call at 610-695-9913. I hope all is well. See you soon. Bye.